Welcome, everyone. Thank you for taking the time to learn about diabetes and understanding macronutrients. Before we get started, I do want to introduce myself. My name is Vince, and I studied nutrition and psychology. And I'm also a registered dietitian. And I've been working with people with prediabetes and diabetes on helping them lower their blood sugar through nutrition and lifestyle changes. And I want to share with you how to manage your blood sugar without any food restriction. First, let's learn a little bit more about prediabetes. Prediabetes is very common, and about 96 million Americans have it. And you can have it for years and without knowing about it. And right now, the statistics is 80% of people with diabetes or prediabetes, I'm sorry, don't know they have it. Luckily, it's reversible. And if we learn about it and learn how to manage it, we should be able to get out of that pre-diabetic range. The next one is type 2 diabetes. Type 2 diabetes um, is very common. The 37 million Americans have diabetes, and more than 90% of these are type 2 diabetes. Type 2 diabetes was previously diagnosed for people that are age 45 or greater. But now we are seeing it more in children, in teens, and even young adults, which is why it's really important to learn about what causes prediabetes and type 2 diabetes. So, what causes prediabetes and diabetes? Insulin is a hormone made by your pancreas that act like a key to let blood sugar into cells in your body for use as energy. So, in other words, there are keyholes in each cell, and insulin is needed to let those blood sugar into the cell. And then once blood sugar is in the cells and out of your blood vessels, your blood sugar decreases. However, if there's a consistent high blood sugar, your pancreas makes more insulin and more keys. So it's working over time. And the keyhole in the cells gets overused and damaged, and it's only letting in small amounts of blood sugar in the cells, which means it hangs out in the blood vessels longer, um, and in more insulin and more keys are need to be created by the pancreas, and that overload just damages the pancreas as well, setting the stage for the pre-diabetes and type 2 diabetes. So high blood sugar, right? That's what we're talking about. High blood sugar, regularly having high blood sugar levels can result in permanent damage to the blood vessels because it's just hanging out in there. And blood vessels are connected to the rest of our organs, so it'll be affecting our eyes, our nerves, and our kidneys especially. Some symptoms of high blood sugar are increased thirst and dry mouth. You're going to the bathroom a lot more often, tiredness and blurred vision. And there are several keys that affect our blood sugar. These are going to be stress. Stress will definitely increase your blood sugar. Illness, if you have the cold, if you have the flu, that will affect it. Lack of exercise is definitely a key. Lack of exercise or exercise in general, exercises promote overall health, and it also promotes insulin sensitivity. So the insulin or the cells in your body are more ready to accept those blood sugars. So your blood sugar is very stable, but without lack of exercise, it's not a lot of activities going on. So energy is not needed. So those cells are not accepting those sugar right away. Dehydration affects it. If you're on any medications, this will definitely be a key factor that should be on your daily routine to take your medications to lower your blood sugar. And one big factor that we'll discuss a little bit more in detail today is nutrition. Nutrition is a key determinator for your blood sugar. So on the left-hand side is the diagnosis of prediabetes, type 2 diabetes based on A1C. The A1C test measures your average blood sugar for the past 2 or 3 months. This is usually done by your doctor every 3 or even 6 months, depending on your blood sugar levels. If you're on the higher risk, there'll be testing more often. So A1C less than 5%, 5.7% is considered normal. Anything between 5.7% to 6.4% is considered prediabetes. And whenever you go from 6.5 or anything above, that's considered type 2 diabetes. So on the right hand side is the fasting blood sugar or blood glucose. And fasting means no food or drink except water for at least 8 hours before the test. This test is usually done first thing in the morning. Something similar that they could be doing is blood work. Whenever you get your blood work done for your doctor, they typically recommend you to fast right for 8 hours before the day before your appointment. So similar to that. And the numbers are over here. So less than 100 is considered normal. Anything between 100 and 126 are considered pre-diabetes, and more than 126 is considered diabetes. So you might be wondering, what you could do or and how to prevent it, right? Prevent diabetes, or how to lower your A1C, or how to lower your blood sugar overall. And what's important is understanding macronutrients. Macronutrients are really important because they are the food that we eat. We use them as fuel, and this causes our blood sugar to go up. So learning about which food raises this can be helpful. So carbohydrates are the primary source of the body. This is the preferred fuel source by the body, so we digest it very, very quickly. Carbohydrates are digested into glucose. So whenever you hear glucose, it's the same thing as sugar, kind of fancy scientific term for sugar. So carbohydrates are digested into glucose by the body. So in other words, after we eat a piece of bread, it will get digested and it will go to our blood vessel, causing our blood sugar to go up. Carbohydrates provide 4 calories per gram, and some examples are bread, beans, pasta, potato, rice, and fruit. So a lot of people are confused about carbohydrates, and they want to limit it or even restrict it, right? But keep in mind that it's more important to eat the carbohydrates from healthy sources as well. We want to include carbohydrates from healthy sources to get those vitamins and minerals. So when choosing a carbohydrate, there are two types of carbohydrates that you'll see. They're going to be the whole grains and the refined grains. And whole grains contain the bran, the germ, and the endosperm. They're typically higher in vitamins, minerals, fibers, and phytonutrients compared to the refined grains. And the main difference between the two is the bran and the germ. So for the whole grains, it still contains that and it gives that the brownish look. And while for the refined grains, they remove those bran, so making it the white breads and the white rice. So fibers in whole grains, there's a lot of fiber. So fiber slows down the digestion of carbohydrates. So it's preventing that blood sugar spike. So whenever you're digesting fiber, what fiber does, it slows down the digestion of or the transfer of from your intestine to your blood. So it's slowing that down, preventing that blood sugar spike that we don't want. We don't want to see. Some examples are barley, brown rice, oat, quinoa, whole grain cornmeal, whole wheat bread, whole grain cereals, and crackers. And when we go to the grains, refined grains have been processed to remove the bran and germ, to improve texture and improve shelf life. So when they remove this, they're also removing the dietary fiber, the iron, and a lot of vitamin B. So some examples are white rice, white pasta, refined cereals, and crackers. And since, like I said, since those fiber the fiber is removed, these items are easily digested because the bran and the germ are removed, which means they increase our blood sugar immediately. Um, and sometimes it's eating 100% from the whole grains is hard. So this can be overwhelming again, or sometimes the alternative is just not as good, right? So it's all about balancing. So even eating 50% of your whole grains is great and could provide benefits. So for example, around lunchtime, your carbohydrate source is white rice. And then for dinner, you can choose either brown rice or even quinoa. And you can just play around, right? So just balancing between the whole grains and refined grains, but definitely emphasis on the whole grain. So the next macronutrient is protein. Protein is an essential nutrient needed to grow and repair cells to work correctly. Proteins are digested into peptides, not glucose, so it doesn't affect our blood sugar. And proteins actually help stabilize our blood sugars by similarly to the fiber, blunting the absorption of carbohydrates. And it also provides 4 calories per gram. Some examples are beef, lamb, chicken, fish, and tofu. For the beef or for these protein types, we typically want to prefer the leaner sides. So for example, for ground beef, you can try to find 93% lean and then 7% fat ground beef, as opposed to 80% protein and 20% fat. For chicken, we can go for the chicken breast. If we like the chicken thighs, the darker meats, let's just try to remove the skin, so to take off a little of that saturated fat. Um, and tofu is generally pretty low in fat. So the next macronutrient, last macronutrients that we'll talk about, is the fats. So fats are the most caloric dense nutrient critical to normal body function. Cell membranes, transportation, absorption of vitamins, and even protects our organs. Fats are digested into fatty acids and glycerol. So same thing with protein. It doesn't affect our blood sugar. It helps stabilize by blunting the absorption of carbohydrates. Like I mentioned, it's the most caloric dense, meaning it provides 9 calories per gram as opposed to 4. So some examples are extra virgin olive oil, canola oil, butter, large fatty meats, cheese, and full fat dairy. So now we talked about or learned about the macronutrients of carbohydrates, of your protein and your fat. Um, it's important to combine all of those things to make your meal a balanced meal. So every time you're looking at your meal, you should try to identify where your carbohydrate is, where your protein is, and where your fats are coming from. So overall, eating a balanced diet can help with feeling satisfied and help stabilize your blood sugar. This picture here is a great template to better picture your plate, and it gives some examples as well of what they are. So knowing which foods increase your blood sugar will help you manage your blood sugar levels. And just to review again, protein and fats don't affect your blood sugar. Carbohydrates increase your blood sugar, but should not be restricted because it is the preferred fuel of our body. One important reminder here as well is for the fluid intakes or the fluid. For example, here on this plate, it says water. Water doesn't affect our blood sugar, which is, what we like. But we have to be careful of the carbohydrate content of the sugary drinks, right? So for example, sodas, those are those are fluid, so our body doesn't need to digest it, right? It goes into our blood immediately, so it raises our blood sugar. And similarly with fruit juices, or anything like Hawaiian punch or any sweet drinks like that, that will be similar to soda. So in this slide right here, this is just an example of a breakfast that you can utilize, or you can, take advantage of, or base it off. And this is a avocado toast with egg and on a bread. And the carbohydrates on here will be the bread, the fats will be your avocado, and the protein will be your eggs. So always try to figure out or try to add into your meal to make it balanced where your carbohydrate is, where your fat is, and where your protein is. And on the next slide, it's going to be an example of lunch. So on the left hand, you have your veggies, which is your fiber, so it'll help slow down the digestion of carbohydrates. Protein, which are chicken, and then carbohydrates and fat here because of the potato. Potato is high in carbohydrates, um, so this will increase our blood sugar. And since it's fried as well, right? So it's fried in oil, so it would add a little bit of oil in there. But definitely having a complete balanced meal with your protein, your carbohydrates, and your fat, and definitely veggies will help stabilize your blood sugar a lot better, um, compared to if we just eat the French fries and the protein, or the French fries and the veggies. So having all three components are it's very, very important to maintain a good blood sugar. And lastly, the last example for dinner, similar idea. Your carbohydrates are becoming from the sweet potatoes, veggies are your spinach, the protein and the fat are the eggs and the salmon. Salmon has great source of healthy fat, so it's definitely beneficial having it at least once or twice per week. And that would be all for my presentations. Thank you so much for watching.